So there are lots of barriers to involvement. We've already discussed some of them, I think. Still, we have people who think that when you talk about involvement, you're talking about the participant who is going to be interviewed or subject to the research that you're carrying out. So you've still got an awful lot of misunderstandings about what we're talking about, and so there's still a lot of work that Involve does that is about explaining what we're talking about. There's many more barriers probably than on this particular list, and you may be able to think of some yourself. Questions about rationality I've put up there, which we've already touched on. Questions about bias, of course, because people assume that they are, some professionals, researchers will assume that they are objective in their research, and that a service user group will be very biased, and that there is a big difference between their objectivity. And I have seen so many, biased, I'm sure you're all aware of some research that's been carried out that's very biased, entirely professional, entirely even a randomised controlled trial, because everything you do, everything you choose, your outcome measures in particular, your questions, are your questions. What have you chosen, and what answers are you going to get from them? And not having control of the research agenda is a bit of a problem, really. It would be helpful if we were much more up there. I mean, this new Institute for Health Research that I briefly touched on the previous slide does have, again, it has structures that include service users and carers in that structure. But often it's one person sitting on a large group with a lot of with academic researchers, and it won't necessarily have very much of an impact. But we're still working hard at it, is what I would say. We're still working hard at it. And, there are practical issues as well around, actually doing, when you actually come to do the research around finding resources, doing training with people, paying people or not paying people. Your benefit system may be just very similar to ours in the UK. We have enormous difficulty paying people for anything because it will affect the benefits. So that's something that usually comes up in most discussions about work. The Institute of Psychiatry in London, there is something now called the Service User Research Enterprise, led by service user researchers, which is very much in there and doing some very good user-involved research. So that is a worthwhile website to look at in terms of what they're doing. They're doing very much collaborative research on the whole, but some of it is very user-led. They've got very, very good people there. Diana Rose being the co-coordinator of the unit. The project that I've been involved in, I'll tell you a bit about, is the third one down, Learning the Lessons. Evaluation of community services for people with a personality disorder. And that was a large national project led by Imperial College in London, and it had 4 modules. And this particular project was really interesting because one module, the user-led evaluation of these services, was taken by the Mental Health Foundation again, which is a charity, although the project as a whole was led by University, Imperial College in London. And so I got involved in this particular module by doing the training with the group of service user interviewers who came forward, they were all recruited. We did proper job descriptions and asked for people's experience. It was an incredibly very rigorous piece of work, led by a researcher in the Mental Health Foundation who also had experience of mental health problems. And all of the interviewers, as I say, were mental health service users. And basically, it was a long piece of work, and the Mental Health Foundation did subsidise it quite substantially financially. So it's one of those situations where, if you throw money at it, it will happen. And I think that it's a situation where this really was the reality. Many pieces of work, similar pieces of work, might not have been done quite as rigorously, but they were able to find the resources to fund it. So That was very, we were very fortunate. It was an amazing piece of work, really, because people were so involved in all of the interviews. We mostly did them in pairs, going out to these 11 different services across the country. It was a mammoth sort of administrative task for the people who were sort of coordinating it from the Mental Health Foundation in terms of getting people to all the different services, getting their travel arranged, getting everything. It was just a massive piece of work. And at the end, I was very fortunate enough to be brought back at the end, and we were able to do training with the interviewers, those who wanted to take it further, for them to analyse the interviews themselves as well, which is quite unusual because quite often people go out and do the interviewing and then hand it over, and then the researchers will do the rest. Usually in consultation with the service users, getting people together again at the end, but it was one of those rare experiences where we were able to actually sort of enable people to gain some skills in terms of rigorously going, and it was great, it was really, really good. And in the end, they also wrote their own summaries of their own sites that they'd been to visit, and I did the sort of bringing that together and writing up one chapter for the final report. So a very big piece of work, very well funded, and I think very powerful. I mean, whether it's gone on to influence anything, I actually really don't know, but I hope it has. I hope it has. And another one that I just talk about as well in that list, which is the Rethink Recovery Narratives research, which is very recent and has only just gone on the Rethink website. And also we're just writing a summary report together as well. Again, I was involved. Welcome. Sorry, just carrying on talking as if you're not coming into the room. I was involved with training the researchers again, another really fantastic group of people who came forward to take part in that research, and who went and interviewed 48 people about their own recovery journey. And in the end, it wasn't called a recovery journey, it was just asking people some really ordinary questions, very, very similar actually to strategies for living, in terms of, what you found helpful in your life, what are the things that really help you, what do you think of the medication that you're on, what do you think of finding more resources in the community, do you get involved in anything from a physical, spiritual or creative nature, all sorts of different questions. And a really great report has been written up, and we're just bringing together a shorter version of that, which hopefully gives it's intended to have some learning points to enable, aimed at staff and at service users, at carers, to give people ideas of how to help people on their recovery journeys. And that was undertaken at Rethink, another charity, and the funding came from a drug company. Yes. A drug company. I'll say that at the end. It is important, because do we think that drug company... I mean, I almost never do anything. I think it's the first time I've actually done anything funded by a drug company. And I made a very conscious decision, because I knew that the person who was the head of the research at Rethink had argued very carefully with them about the fact that they couldn't influence the outcome at all. And they absolutely haven't. I mean, the only thing they wanted in it was to ask people about the role that medication takes in their recovery, in their lives. That's the only thing. And we have totally written the summary report ourselves between the group of interviewers. So, I trusted the integrity of this particular individual, so I knew that she would have done that. But so drug companies can be a source of funding if you can do a deal with them of that kind. Rethink is an organisation. It used to be called the National Schizophrenia Fellowship. I don't know whether people are familiar with that name. The National Schizophrenia Fellowship has tended to have quite a poor reputation amongst service users in the UK as being a very conservative and a very carer-led charity in the past. And it has made very big changes. I mean, it's a very different organisation to what it used to be. So, it's really worthwhile looking Rethink up on the website.